Joining us here today is Ms. Shylet Sanyanga, the Chief Executive Officer for AHFoZ here in Zimbabwe. So today they were discussing the issue of the amendment that is going to come to the medical aid sector if the amendments are to be adopted. So maybe Ms. Sanyanga, before we get into the other question, can you just give us a brief of what the amendments actually entail?
So these amendments are supposed to be amending SI 330 of 2000, which has been regulating medical aid societies. So the proposed amendments include the need for medical aid societies to disinvest from healthcare service provision. And then there's another amendment which talks to the change in the model to a risk-based capital model. But the major issue that is of concern, which we were discussing today, is the issue of the requirement for medical aid societies to divest from healthcare service provision.
Yeah. So already the issue of access to healthcare in Zimbabwe can be a challenge in some instances. Looking at sometimes the public health sector can be under pressure sometimes. Now, looking at these amendments, should they be approved? What are the likely implications that this is going to have to the healthcare sector?
Oh, there are several challenges, which include, in the first instance, these healthcare facilities are giving services to Zimbabweans. So it means access will be affected because there's going to be a reduction of the facilities whereby members can access healthcare services at lower prices. So quality, ability to access quality healthcare services um, at lower costs, that will be taken away. And then it takes away maybe the bargaining power for medical aid societies, because medical aid societies always bargain on behalf of the patient. They are contributing members. So those facilities have been a fallback position in instances where patients go to a healthcare facility and the doctor or the service provider charges a shortfall or charges exorbitant amounts. The medical aid owned facilities have always been a fallback position, or an alternative whereby they can still decide to say if they can't afford the shortfall, they can go to the funder owned facility. So that will be taken away. It means maybe depending who will be running the facilities, depending what will be put in place, it means patients will have to be either be at the mercy of healthcare service providers who will be running the facilities, or just be resigning to fate.
Okay. And lastly, we know medical aid coverage is around 8% in Zimbabwe.
Sure.
How is this likely going to change should we have these amendments come on board?
The numbers may actually go down because um, patients will then make decisions. And remember, these members, I'm using patients and members interchangeably. When they are not sick, they are members. When they are sick, they are patients.
Sure.
So some may actually, when that, because it's a major component in terms of products that medical aid societies have been offering. So when that is taken away, some may decide to come off medical aid when they stop accessing healthcare facilities. They may decide either to downgrade or to come off medical aid. Some are on medical aid that is paid for by employers. They may also not quite see the point of staying on medical aid if those facilities are no longer accessible. And if they come off, then the 8% that you referred to may actually go down further.
Thank you so much, Ms.